we often think of global health experiences as things that we have to leave the country for. And I think my work in Navajo Nation revealed to me that we do have people living in very similar conditions that we see internationally. So difficulty accessing hospitals due to poor road conditions, people who live without electricity or running water because they're off the grid and because the grid has not really been properly identified or regulated by the government in those lands. And so I think, it's not like that's not a specific story, but just the concept of you can do global health work here.
Welcome to the Prospective Doctor podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello, everyone. Now, I know I say this a lot, but today we have a really special guest, Dr. Sheneka Horne, and I'm just going to let her give us an opportunity to learn a little bit about yourself and your journey to medicine.
Awesome. Thank you so much for having me. I'm very excited to be here. Well, my journey to medicine. There's some caveats to it. I always tell someone I'm one of these people that has to be sure about what they're doing before they do it. And so even though I went to college as pre-med, I got there, I saw the chemistry requirements, and I was like, hold on. Can I do something else that doesn't require this much chemistry? Do I really want to be a doctor? And so I even switched my major to exercise science. And then I, went in this whole roundabout way, basically, that really ended up me being back in medicine. So I thought I was going to be a physical therapist, did that for a summer, thought it was so boring. And then I actually even pursued a master's in public health because I was like, there's a health job out there for me that doesn't involve medicine. Still medicine. So at the end of the day, I decided, yeah.
I love that story because a lot of times we always think like most doctors are like type A people. They want to check those boxes and get there when they're supposed to be there, quote unquote. Mm-hmm. And with me mentoring students, I know a lot of people on the podcast have probably heard this, and it's strange for someone who's doing something about people who want to be a doctor. But I always tell people, if there's anything you think you would like to do besides being a physician, try that first. Yes. And then if you still have that calling, then it's for you and you can pursue it. So I love that you tried to use your love of science and trying to find that right fit, and you just realized that medicine was for you. I definitely can identify with the chemistry thing. I am not a fan of math. I know we end math, and I know that's crazy to say. And I can probably say that you probably are, because that is one of the reasons I did not choose pediatrics.
Amazingly, I do not love math either. It turns out I'm good at it, but I don't like it. And for a long time, I thought it was because I was bad at it. But when I did it and realized, no, I'm actually good at it, I just still dislike it strongly. But I love kids so much, I was willing to overcome.
There were makes per cake.
Yeah. Oh my gosh, girl. Yes. There are apps too. There are apps now that do your calculation. So that's helpful.
Absolutely. For all of the listeners out there, since we have a variety of listeners from pre-meds to medical students to residency and beyond, as you get into your pediatric rotations, there, as you know, eventually you'll be able to prescribe medicines. And a lot of the medicines for adults are pretty like, okay, if you're over this weight, you're going to get 50 milligrams, blah, blah, blah. But for children, it's weight-based. So there are a lot of calculations. They're not that hard. I'm being dramatic, but something to consider and think about.
No, I mean, once you get into it, yes. But I remember the learning curve intern year of being like, I'm supposed to do this. How?
Absolutely. I remember I was writing about this recently because for some article that I'm going to be in, but they asked about a memorable experience of when I was training. Mm-hmm. And it reminded me of my first night on overnight call, which is actually my first night of intern year. And I had a call for a baby who had a fever in the hospital. So the baby was okay, but like, of course, we wanted to give it some Tylenol. So it was my first time prescribing medicine for a patient, period. And it had to be a baby.
Yes.
So I think I paged the nurse and I was like, so if this was you, like, does this sound about the right dose? And then my senior and things, because I didn't want to overdose that baby on my Tylenol.
Wow.
So it's definitely a learning curve.
Absolutely.
So you are a global health pediatrician. A lot of students have questions in terms of how can they create impact or how can they become involved in global health during their experience. Do you have any tips for that?
Absolutely. So again, my path to global health was quite circuitous, just like my path to medicine, in that I wasn't sure what kind of pediatrician I wanted to be. And so that's how I ended up doing the global health fellowship. But in medical school, like my medical school, I went to St. George's University, which is a Caribbean medical school, and they had opportunities to do selectives. So we had the opportunity to travel to Kenya for a 2-week period, travel to Thailand for a 2-week period to see how the health systems functioned in those countries. And they had other countries as well. But for me, I was like, let me pick the countries I'm interested in and go, and you had to apply and do that. So for me, global health was always kind of part of my journey. It was something I was always interested in. It gives me perspective practicing in America. So I figured out different ways along every layer that I went through to have some global health experience. You don't have to do that. Obviously, you can just decide you want to try something. There's a lot of programs. This program's literally available at every level. So people do abroad programs in college. There's a lot of medical tourism programs. And then, like I said, my med school had those opportunities. In residency, we had a call-free month, which is a month you don't have to be at the hospital to cover any other unit, like overnight. It's an elective month, which means you can go to another hospital or another place and see how they work. So for people who want to do private practice, they could go and work in a private practice for the month or whatever. I chose to go to Ecuador and Peru and work with a children's program there and support them for that time. So I was like, I'm going to be global. I'm going to travel while I'm in residency. So just always looking for opportunities. And there's so many. You can really like search it. The thing I would advise is choose a program that has an ongoing presence in a community. You don't want to choose a program that comes in for a week, does some interventions, and then leaves, because that's actually more harmful than it is supportive to those communities, right? You want to choose a program that is, using local interventions, using local staff, and is teaching people on the ground how to maintain, because you want to be a part of things that are sustainable and not things that are just like a quick fix. So there are a lot of opportunities for that. Of course, as a doctor, you can do things like Doctors Without Borders, and there's a ton of other organizations that are doing similar work, but definitely do your research, check to make sure it's something that's established. And when you go, please don't take those poverty porn pictures, pictures of kids that are, maybe dirty from playing or whatever. Like, let's try not to promote the images of poverty that we see in a lot of countries. So I think as long as you go and you're conscientious about the work that you're doing and the images that you're sharing, go for it and do it.
Thank you for sharing such valuable information. I think that a lot of students are looking for these opportunities right now, especially even though we hate talking about it, so we're still in a global pandemic, and there's so many different things that we can do to impact the world. And 3 things that I want to point out that were important or stood out to me was, yes, it's possible to travel when you're in residency. Most programs do have elective months, so it may take some careful planning to figure out how you can coincide with a mission trip or some different opportunity in arranging that. So seeing how your year will go. Number 2, definitely don't be that person who's just posting things for self-glorification. Like, we live in the age of social media,
Yes.
But remember your purpose and why you're there and how you would want you or a family member to be treated if you were receiving that kind of care or you were living in that environment. So go there to improve it, but not just to showcase it. And then your 3rd point about going and picking a trip or partnering with an organization that is mission driven and also sustainable, because you don't want to go somewhere, have this impact, have to leave, and then the patients have nothing or there isn't a real impact there. So I appreciate that.
Yes, absolutely.
That brings me to my next fun question. Since you've been doing a lot of exploring, would you mind sharing an interesting story or something that touched you from one of your global health adventures?
Yeah. Gosh, there are so many. So I guess more recently I did my global health fellowship. I graduated in 2021, and that's through University of California, San Francisco. There are a few other global health fellowship programs, especially for peds, but the UCSF program accepts all specialties. So if you're looking any specialty, anesthesia, OB, whatever you want to do, you can travel and do this fellowship. But part of our fellowship is you spend half the year in the US in Navajo Nation, and the other half is international. And I think we often think of global health experiences as things that we have to leave the country for. And I think my work in Navajo Nation revealed to me that we do have people living in very similar conditions that we see internationally. So difficulty accessing hospitals due to poor road conditions, people who live without electricity or running water because they're off the grid and because the grid has not really been properly identified or regulated by the government in those lands. And so I think, it's not like that's not a specific story, but just the concept of you can do global health work here. I have also done in the last year worked at an Afghan refugee camp. So since the removal of the US presence in Afghanistan, if you've been following the news, the Taliban has reclaimed control and power and has made life very difficult for a lot of people. And so for everyone that was supporting the US government, a lot of them got evacuated to the US. And so last year, I started working at a refugee camp in New Jersey. You would not think that these things exist in this country, but they do. And then we also relocated to Virginia later in the year. But for the New Jersey portion, we were literally in a tent on a military base. We created a tent hospital. The guests were living in tents as well. And we're talking about people who have to literally run to catch planes, get through like commotion. I treated kids that had been trampled during that experience, kids that had a lot of PTSD, had seen people shot right in front of them, had family members that recently passed away, had terrible like traumas in that way. And then of course, there are just kids who were just PTSD from the quick move and separation of family and all of those things. So I think sometimes when people are looking for global health opportunities, you can recognize that there are some inside the country. And I, for one, loved my Afghan experience because you do get exposure to another culture. We had translators for the multiple languages that were spoken, getting to connect with people, totally different culture, totally different religion, totally different healthcare practices that they're used to. So you can learn about all of these things and support people even within the country. So I think that's kind of my story. That's not a direct story, but
it's a great point to bring up because there are so many rural environments and so many different ways that we can aid here. Mm-hmm. So it's great to not put yourself in a box and to realize that there are so many people to help and so many ways to do it.
Yes.
So on to another topic. You are the creator of the Blk Doctor.
Yes.
Can you tell us about that?
Yeah. So after fellowship, part of the reason I did the fellowship was in residency, I noticed that a lot of my attending physicians, my senior physicians, were showing the symptoms of burnout, were, a little bit exhausted. As we know, the culture of medicine is continuously changes. And part of that, the more recent changes are that there's a lot of corporatization of medicine. So there's a lot of, push to have providers see more patients within the hours because of reimbursement rates or other policies by insurance and things. So we have a lot of people seeing more patients and not necessarily having the opportunity to provide the kind of care that they thought they would provide when they got into medicine. And so in creating the Blk Doctor, I was trying to figure out, how do I support other Black physicians who are feeling this pressure to perform their work in a certain way, but not in the way that they feel like best impacts their community or is the best possible way to take care of their patients? It's like, for me, I enjoyed spending a lot of time with my patients and explaining and doing patient education. And those are the factors that I feel are the most rewarding in my job. And so not being able to do that because someone's telling me I got to get to the next patient and I got to write charts and I got to do all these things makes me not want to practice. But there's such a danger in all of us trying to exit medicine because the culture is not what we need it to be and not what we necessarily signed up to be. And so the mission of the Blk Doctor, long story short, is to support other Black physicians in creating medical careers that still maintain fulfillment and still allow them to practice the way they want to practice, even in the current culture of medicine. So I do a lot of coaching for other Black doctors, helping them to create those boundaries, how to ask for what you want, just even those opportunities of like, I want to do something internationally. Does your job allow it? How do you ask for that? How do you negotiate for those terms that are going to bring you fulfillment and bring you joy when you go to work every day? Because let's face it, medicine is hard. You work long days, you work for a lot of people. And so if you are not very clear about what your goals are, what you want to get out of it, how to ask for those things, and value that you can have a fantastic practice or work in a hospital or clinic and have that connection that you most desire with your patients and have good patient outcomes, and use that as your reason for asking for what it is you need as support. So that's really what we're teaching at the Blk Doctor.
I love everything about that. I feel as though for the listeners out there, regardless of your background, your ethnicity, and all of those kind of things, we're in the age of the Great Resignation.
Yes.
And a lot of people, especially like during the pandemic, took time to reflect and figure out like what was important to them and what are their no-goes, what are their boundaries. And the healthcare system is broken. So like you said, a lot of the things, you guys are closer to your why, as in you're writing your personal statements, you're looking into residency programs, you're looking into med schools and things and trying to figure out like, okay, how do I get to become this doctor that I've kind of like idolized and kind of have this idea of what medicine is? Like, okay, I got to learn how to treat them and then I get to help them. But that's not how it really works in the real world. Mm-hmm. There is a lot of administrative burden and things that cause a lot of physicians to quit, and a lot of them have. And on top of that, we're not going to leave that elephant in the room. Black students face more barriers in medical school and residency than other groups. It's been studied, it's been validated, people talk about it. There is not a lot of support. We see that in the real world when we talk about all of the things that have come out with DEI and supporting and health equity and all of those kinds of things where we're trying to reach out to our patients and help them. But the workforce is suffering as well. And Black people make up only about 5% of physicians, period. I think Latinx people make up also about 5%. And Native Americans, I think, make up less than 2 or 1.
I was going to say less than 1.
Yeah, less than 1%.
Yeah.
So there is a lot of help and cultural competence that has to come with that. Mm-hmm. So it's great that you are given these opportunities for people to figure out what they want and how to do it. So what are some ways that students who may be marginalized can find support?
Yeah, that is a great question. I think that for you, for anything you're doing, regardless as to where you are, finding support is going to be your main avenue to success. So building a community, right? Whether that's figuring out who supports you and how to get that support and what support you need, reaching out to others. The thing that I think that's funny in medicine is that we're all on the same path, on the same timelines, right? So you have this immense pressure to perform at a certain pace and continue to do things exactly the way it's been laid out for you. And when you really dig and you really talk to other students, other residents, other colleagues, everyone has some thing that they've hit that maybe took them off the timeline or took them off the path or changed the trajectory of their career. So, when you're seeking support, don't think that it's like you're the only one that's ever had this problem. Understand that everyone has different problems. And we as Black physicians, of course, face all kinds of challenges. So whatever your challenge is, like, that's okay. There's 100,000 people that have also experienced your exact challenge. So I think that that's like one of the important parts about seeking support is like knowing you are not alone, and that like we've all had failures. I know so many people that have failed exams. I know so many people that have repeated classes. I know so many people that haven't matched the first time or didn't get into med school the first time. There is support for every single one of those things. It does not mean that you cannot meet your goal. I think we need to redefine failure as this is something that you get to overcome, and it adds to your story. And it makes for a great interview too, right? Like whenever you're interviewing along the way, people are so embarrassed to talk about their failures, but it's like, no, you're showing that despite the failure, you have such strength of character that you overcame this thing and you were able to move forward. So whenever you're seeking support, no matter what it's for, you are not alone. You can reach out to other students. There's a lot of organizations, particularly for med students, for residents. I know I do some resident supports for American Academy of Pediatrics. There is a free mentoring program for medical students who are interested in applying to pediatrics as a residency. So you can apply to things like that. Check out those like organizations from whatever specialty you're interested in. There are support programs through those as well. So there's a lot of choices.
That's a lot of valuable information. And I think that a lot of students fall into that trap when you've been like kind of the best of the best, quote unquote, all these years, and you've passed these hurdles and you've gotten into school, and then you're there with all of these wonderful people who are scholars, and you might fail a test. You might fail the board. You might not do well on a rotation, and people get embarrassed and
Right.
you're too afraid to ask for help because one, people aren't going to tell you about their failures. People are posting on social media like, yes, pass that test, go into the bar. Like once, actually, some of that's not true. And then also, if it is true, they may be excelling at one thing and not the other.
Right.
Or they may be utilizing resources that you may not be looking into. Like, I know when I was in med school, when I first got there, I was like, what is this? Y'all know it's like drinking from a fire hose. So some people were talking about getting a tutor, and I was like, I've never used a tutor before. No, why would I do that? And then you go and you use the tutor and you realize half your class is in there. So these resources are here for a reason.
Yes.
Utilize your interest groups, utilize coaches. We have our organization here that sponsors this podcast, Med School Coach. If you're looking for test exam prep or looking for ways to prep for your interviews, there are resources out there. You've heard a lot of our guests talking about that. And then talk to your friends and your colleagues and your classmates, because you're not alone. A lot of these people, once you bring it up, will tell you what they're using. If they're using a specific question bank, or if they have some new website or something. We're in a digital age, so it's up to you as an adult learner to figure out what works for you and how you can move forward.
Yeah. I want to point out also, when you figure out what works for you, stick to that. I think a lot of us have shiny new object syndrome, and you hear about the latest resource or the latest thing and you want to get on it. Especially when you're studying, it's like, oh, there's some new something. It's like, but if you know what works for you, stick to what works for you. Like that is what's going to make you successful, is figuring out how well you study, how well you learn, and going with that. Also, there's a lot of adult diagnosis for ADHD, right? And so a lot of people feel like they did fine in school, and you'll see that I've spoken to way too many Black physicians who didn't get diagnosed until they were adults in their 30s, because it's just not something that we talk about in our community, and it's not something that is like widely tested for. People are very afraid of labels, and it's like, no, but you're an adult. If you need extra time, if you need medication to pass your exams, why make your life more difficult? Like, do that thing that you need. There's a million people using those support things that you have no idea about, and you wonder why X, Y, and Z is doing so much better than you. It's like, because they sought out the support they needed and they did what they had to do. So do what you have to do for you, because it's your journey. At the end of the day, the only person that you have to have a good relationship with is yourself.
Absolutely. And I just appreciate all of the pearls of wisdom that you've shared today. Hopefully it's resonated with our listeners. I just want to give you an opportunity to say goodbye and let the listeners know how they can reach out.
Yeah, so you can follow me on Instagram or Facebook at the Blk Doctor. Black is spelled BLK, so the BLK Doctor on Instagram and Facebook. The website is the same, theblkdoctor.com. I do some free webinars for residents who are interviewing or people interviewing for residency, but I don't do that very often, so you should probably rely on a more reliable resource like Erkeda mentioned. But yeah, just reach out. I'm happy to answer questions, open to conversation. So thank you so much for having me. It's been a pleasure.
Thank you for coming. For all of the listeners out there, don't forget to click that subscribe button. I know you're probably listening wherever podcasts are found, but now we have a YouTube channel, so check that out. It's under Med School Coach, where you can see our smiling faces and put comments up and ask questions. And if you have any requests for any particular guests or topics, you can reach out to me on my Instagram at DOCTOR, the letter D, Graham, GRAM, Dr. D Graham, and let us know what you want to hear. See you next week. Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward medical school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.